Evening. Hi everyone, I'm Christina. I've done videos before, mostly about my family or my daughter, who's the biggest part of my life, but this video is a little more personal. It's talking about a condition that I have that I've been looking for some patient perspective articles, research, videos, and I haven't found too much, a tiny bit, but so I thought I'd make one and see how it goes. This is just kind of an intro video, and then I'd like to do 3 more, just breaking it down. So I'm talking about a condition I have in general terms, congenital heart disease or congenital heart defects, however you want to refer to it. So if you know what I'm talking about, maybe I've searched this and I found it. So, well, I hope this helps you, at least to hear that other people feel the same way. So basically, I had a recent cardiology appointment. I see a pediatric cardiologist, mostly because some adult doctors really just don't know what to do with you. I shouldn't say it that way. It's a developing field, and I shouldn't say it like that because we really do need the collaboration between the pediatric cardiologist and adult cardiologist, because the biggest thing is we are one of the first generations to be living in mid to later adulthood with congenital heart defects, repaired heart defects. And it's a developing field, and it's wonderful that there have been advancements where we can live longer. But there's also many questions out there because, again, this is kind of the first time, and some stuff comes up where it's a new challenge every time because it's the first time that we're really seeing this, and where people are living longer like this. So I'll go to the pediatric cardiologist office, and usually cartoons are on, and probably the patient before me or after me is like 5 years old, and I can remember being that patient too. Usually the waiting room is filled with more kids than any adults. Once in a while there might be a 20 or 30 some year old, but now I'm seeing some 60 and 70 year olds, which is awesome, but again, new challenges. So again, there are different conditions, CHD. So you can have defects that are mild, moderate, or severe. I would say mine were moderate. They're moderate, but again, so they're repaired. And, it depends on how it goes, how many repairs you need, what else might happen. Still, living with a repaired heart, there is more wear and tear, and it's not going to it doesn't function as well as, a heart that doesn't have any issues. And with some people, it can eventually, the heart becomes overworked, and you can develop something called like heart failure, which I'm starting to deal with now. As a kid, I did not have need to take any medications, which I think I took for granted at that time because I was asked quite frequently, "Oh, what medications are you on?" And I'd say none. And I definitely took it for granted because now I have to plan it out every day how many I have to take. So anyway, so I was born with AV canal or atrioventricular septal defect and a coarctation of the aorta. Briefly, so okay, the AV canal, that's normal anatomy. Let me do that. Okay, you have 4 chambers. You have 2 atria on top and 2 ventricle on the bottom. We have 4 valves. Okay, and the aortic valve sends blood throughout the body. The pulmonary valve sends blood to the lungs. I shouldn't say, but it's a valve where it sends it through the vessel to go to the lungs, etc. And then you have the AV valves, which are your mitral and tricuspid valves. So instead of having 2 valves there between my atria and ventricles, I had 1. And actually, usually you go along with an ASD and a VSD with those, meaning a hole between the chambers, a hole in the heart. And those were repaired as well. But the bigger part was making 2 valves out of 1. And that was done when I was a baby. Actually, I was 2 years old for that surgery. And the coarctation of the aorta, what that means is the aorta is the largest artery in your body, and the aorta sends blood from the left ventricle. It goes through the aortic valve, and it sends oxygen-rich blood through the rest of your body, your organs, your muscles, your brain. So it's very important. So the vessel, the aorta, has a narrowing, and they refer to that as the coarc. So that was actually repaired when I was 6 weeks old for via closed heart surgery, and my first open heart was at the age of 2. And then after that surgery, again, it was a big surgery. It took a long time, and I developed, so a lot of stuff kind of needed to be cut and sewn. I developed so you're dealing with some actual, like, circuitry, there's the contractions of the heart are actually controlled by other nodes in your body sending signals to contract. So I think of it as like electricity in a way. But anyway, so the circuits kind of got cut, and I got third-degree heart block. So there wasn't communication between, like, the top 2 chambers and the bottom 2. So I now have a pacemaker, not a defibrillator, just a pacer. And that was put in starting at the age of 2, and I have it replaced about every 5 years. I know sometimes I get 6 out of it, but, it depends if I'm lazy that year. So basically, pacers should last about, depends on the manufacturer, but about 10 years, depending on how active you are. So mine have been about, I think the last one may have been 7 years, actually. I don't know. You get the idea. So anyway, to sum it up, I've had 5 open hearts, and I don't know, a lot of generator replacements, and a bunch of catheterizations. So, and now, I think the only other issue I started developing, which was surgically repaired after medical management, was atrial fibrillation, which you guys have probably, if you don't have it yourself or haven't had it, you probably see a lot of advertisements from blood thinners out there. If you have AFib, talk to your doctor about, anyway, I'm not going to mention a drug, but you get the idea. So that was an issue when I was a teenager. In general, I'm usually a very happy person. I was very happy as a child. I knew I had a heart problem, but I didn't let it really control anything I did. I usually would get more upset about anything where my cardiologist would say, you really shouldn't do cheerleading, or you shouldn't play softball because I'm worried the ball's going to hit you in the chest. So I said, well, what if I wear a vest? Or, I just got more frustrated that I was told I couldn't do something and tried any way around it to do it. And I think I'm hitting a brick wall in adulthood now with a particular issue, childbearing pretty much, where I'm not finding a way around it. And that's one of the videos I'll do later. Obviously, it's geared a little bit more towards women. Sorry, guys. But please listen. Actually, it'd be great if the guys did listen to get some female perspective on it. But moving on. So basically, I didn't take any medications when I was a kid until I started having the issues with AFib. And again, when you have heart defects that are repaired, and I had the whole issue with kind of the heart block there, stuff can get funky, you can have the signals kind of sent other places, and the heart pumps improperly, and that's kind of what was happening. And I was developing what you'd call like heart failure symptoms, shortness of breath, fluid retention. If you've gone through this, you know what I'm talking about. And I was in high school, and that was really not the time to be having that stuff happen. But you just deal with it, and I didn't really let it get to me too much. Now that I'm much more aware of the complications of it, I guess it's probably good. I didn't really think about it too much. Just went with the flow, took what I needed to take. I I was a pretty good patient. I was pretty good. I think the fact that I was 17, 18 years old didn't help. As far as taking Coumadin, they didn't have the new medications out. But on the other hand, we know how Coumadin reacts and get therapeutic levels, and you know how to manage it with your diet. And there's also an antidote out there, which is can't really be said for all the new meds out there. So anyway, it's probably the safest thing to be on. So we did that for a while. That was about 10 years. I had the AFib. And the valves were getting worse, probably due because of the AFib, and or just lifestyle.